Okay, so let's talk about how you can assess a client for allergy and intervene as needed. This is one of the NCLEX testing area. So it's important you stay focused throughout this lecture because it covers everything you should know about assessing client for allergy and intervene as needed. Now, the first thing NCLEX wants you to know is client assessment. You need to be able to do that. So if they are asking you on a question, right? Somehow the question is resembling that of allergy, then your first step should be assessment, right? And when you're doing your assessment, you are trying to gather information about the client or what puts the client at risk for allergy reaction. You understand? So you need to like obtain or look at the option to see any kind of health history that include previous allergy reaction, family history of allergies, right? Any prior adverse effect to medication, food, environmental triggers. Allergy reaction can kill, so it's important for you to be able to assess your claims. You understand? Get the good history. Most of the time, the NCLEX might not require you to find out uh, the earth history, but they are going to make the earth history available for you so that you can use that to create your judgment, right? To create your judgment. But basically, the sign and symptom of allergy you should know for any allergy would include all this rash, hives, inching, swelling, shortness of breath, anaphylaxis. So these are things you definitely want to know. Keep in mind. So if they're asking you a question about a certain food that a patient got, and you're not really understanding what the question is asking you, just look at the answer choices. Look at it if you have options that can kill the patient or any option that is resembling that of allergy, go for that kind of option. That is the answer because the NCLEX is testing safety. So that particular option that can kill that patient faster, you understand? That's the answer. Now for allergy, you just want to look at statement like this, swelling. Swelling goes beyond the statement swelling because sometimes the NCLEX might just give you angioedema. That is a form of swelling as well too. They might give you edema. That's a form of swelling. It can be a reaction to allergy, right? So yeah, chronic condition you should as well know. There are some for a patient with asthma or any condition that gets triggered due to allergy. Those people are very important. Those kind of patients are very important. Those are the kind of patients you need to monitor for allergy reaction. You understand? We are going to really go deep. Number two, right here, we have allergy assessments, right? As far as I'm concerned, what you should know, the key area you should focus on are medication allergy, food allergy, environmental allergy, contrast dye, right? Or anesthetic allergies. You need to know that, right? Medication allergies such as antibiotics, NSAID, so on and so forth, right? Food allergies like shellfish, nuts, you need to know as well too. You understand now? Environmental allergies such as um pollen, pet dander, and latex. You need to know that as well too. Now, contrast dye or anesthetic allergy if applicable to um upcoming procedure, right? These are things you need to know because when the NCLEX asks you question, the NCLEX might tell you a patient just recently had an allergy to penicillin. What or which of the following order would you question? Now the NCLEX is trying to tell you because the patient is had allergy to penicillin, there's a specific medication such like another antibiotic that has the same similar compound as penicillin that can cause that same similar allergy reaction. So you need to question that order. These are questions you can get from the NCLEX exam. Latest allergy as well too is whereby you don't use any latest products. You avoid using that for the patient. Food allergy, you just pretty much ask the patient, do you have any allergy or that, right? Contract die, be ready to, sometimes the NCLEX might tell you to give medication that will not cause the allergy in advance. And sometimes the question might tell you they gave contract die to the patient, right? And the patient is experiencing this sign and symptom of allergy. What would you do? You give medication for that. You understand? You give medication for that. First medication they give for all those mild allergy uh, is antihistamine, right? For severe allergy, you give epinephrine. That is what we need to. We are really going to talk about that though. Um, okay, right here, emergency response, right? You need to be prepared as a nurse, right, to manage allergy reaction such as anaphylaxis, because that is the killer type of allergy, right? You must have your epinephrine medication, your antihistamine medication, corticosteroid, bronchodilator on hand. For severe allergy, you give epinephrine intramuscular. Very important, right? You want to keep monitoring for the vital sign and keep providing airway support as required. Contraindication is also important as well too. Yeah. For preventing why is it important? Because it prevents administering medication or exposing the client to substances they are allergic to. You understand? So most of the time, the employer is not going to give you that hint that they are testing you for contraindication. But when you read and understand the question, you'll be able to know it seems they are testing you for contraindication. Once you compare the question, compare the answer choices, you definitely know and you select that contraindication. What is either making you to not administer the medication, to stop the medication, or question the order? Those are the likely answers, right? Client identification, I do tell my students all the time client identification is very important. Even if they tell you a nurse is preparing to administer a certain medication, right? And that same question has answer choices as verify the client identity, access for allergy. A lot of students jump to selecting access for allergy. No, the first step for medication administration is always to verify the patient's identity. Then after you can access for allergy if you want to, but these are common mistakes people do on the NCLEX exam. They jump to allergy. You understand instead of client identification. But if the option don't have client identification, then fine, you can go for allergy, right? So I just had to put that there, right? Um, I do tell my students that if they ask you about any medication and you are not really familiar with that medication, check the answer choice. Look for maybe they ask you about a particular medication and they say, what would you report to the doctor? You are not really familiar with the medication. It's best to look for what you feel will kill the patient. If you are not really sure, most of the time NCLEX tests for allergy in such kind of question. Now, the observation of allergy are rash, itching, difficulty breathing, wheezing, shortness of breath, you understand? Edema, angioedema, swelling of the lips, all those kind of good stuff. Hypotension, throat tightness, cyanosis. These are things you need to report to the doctor. Just look at the option if you have an hint of anything closer to this listed information I gave to you. Select that. Those are always the correct answer, right? Remember, severe allergy, I told you, you give epinephrine. Mild allergy, you give antihistamine, right? Airway management. Airway management is vital for the NCLEX exam. Some people don't know how to manage airway. To manage airway, we start by elevating the head of the bed. After elevation of the head of the bed, we give oxygen. Oxygen might not be on your answer choice, it might be bronchodilator, but you must elevate the head of the bed first before you give bronchodilator or oxygen. You understand? Very important. And then more advanced method might be needed. Airway maneuver, intubation in severe cases, right? You just need to understand what is going on, how severe the case is, to know the right airway management, right? So there's one thing about when you give epinephrine, there's always a rebound reaction. You also want to monitor for that because that is where your airway management is very crucial. So now let's do some sample questions, guys. Now we have a nurse preparing to administer an antibiotics to a client reporting an allergy to penicillin. Which of the following is the most appropriate action? Now we are preparing to administer antibiotics to a client. They told us they have allergy to penicillin. What should we do? Definitely, I know I'm not going to give the medication. So let me read the option. Administer, no, I will not do that. Contact the healthcare provider to verify the order. Sound like something I want to do. Administer histamine before giving the antibiotics. No. The fact that we know that this patient has allergy to this medication, we are not giving it at all. You understand? Document the allergy, but administer. We don't want to administer. Do we want to kill the patient? No, so we want to do B, guys. Okay, guys. So now, next question, we have a client, right, receiving IV contrast, developing difficulty breathing, wheezing, and a rash. What is the nurse's first action? The patient is receiving IV contrast, and they are developing all these killer side effects or adverse effects, adverse reaction. Now, what's our first action? First action means that you want to do something now in a hope that is going to help the patient right now before another thing. So what do we do? Are we going to stop, administer antihistamine medication, notify the healthcare provider, place the claim in a supine position? Now, we want to stop. That is what we want to do because now if we stop, there will not be further more difficulty in breathing. Let us say maybe their respiratory rate is uh 18 before it reduced to 8, right? The moment we stop, it's still going to maintain that 8 before we start more intervention to help them improve their difficulty in breathing, right? But if we decide we did not stop the infusion, we decide to go and notify the healthcare provider, the time that we are going to spend to go notify the healthcare provider, that difficulty in breathing, the respiratory rate can drop further from 8, you understand, to 6, then the patient will die. So this is how we use our critical thinking, right? Administering antihistamine. One thing is just like right now. Can you it's just like how do I explain it? It's just like right now, I'm trying to look for a best explanation, but the particular thing that is causing the difficulty in breathing is still present. No matter how we give a medication to solve that, the medication will not be able to solve because what is still causing it is still present. You understand? What is still causing it is still present. So we need to firstly stop what is causing it so that the medication will be effective. If you understand what I'm trying to say, right? And we know a patient is having wheezing, difficulty in breathing. Are we going to place that certain patient in a supine position? No. So the answer is A, guys. Now, next question, guys. So now we have a nurse who is receiving a client's health history. Which of the following findings indicate an increased risk for latex allergy? Right? Use of beta blocker, history of asthma or eczema, consumption of shellfish, history of seasonal allergy. Um, Increased risk for latex allergy. The question is asking you for what puts one at risk for allergy. And I told you for allergy, just know the people that are higher risk for allergy are those people that have condition they that get triggered by allergy, by any kind of allergy, right? And that is B. You understand? That is B. So those people are at risk, very much at risk, right? So yeah, I guess that explanation is okay. Now, number 4, the nurse is about to administer a flu vaccine to a client. The client reports a severe allergy to eggs. What should the nurse do next? Now we know there are some vaccine that has that made with egg, right? So and we have our patient right here that have severe allergy to eggs. So what do we do? Since we know that kind of vaccine might cause allergy reaction, we don't want to give it. You understand? So A, proceed with administering the vaccine. No, we don't want to do that. Monitor the claims 15 minutes after. No. Consult the healthcare provider regarding the, yes, that's what we want to do. Pre-medicate the claim. Remember, this is allergy. Um, uh, the patient is reporting severe allergy because of uh a previous allergy to egg, right? And we want to wash out. We don't want to give them vaccine that will cause another severe allergy. So we want to consult the healthcare provider regarding the vaccine. That's what we want to do. Okay. So the nurse is administering a new medication to a client. The client reports itching and develop a rash. What should the nurse do? What's the priority action? Notify the healthcare provider immediately. Administer prescribe antihistamine. Stop administering the medication. Document the reaction in the client chat. What we want to do here is to stop administering the medication. That's the first thing we need to do, the priority right here, to stop administering the medication. Immediately we stop administering the medication, the client will no longer report itching and develop more rashes, right? That's the first thing we need to do. So the answer is C, guys. C. We have a client experiencing anaphylaxis has received an intramuscular dose of epinephrine. The nurse should take which action next, right? What action should the nurse take next? We have monitoring the client's airway and administer oxygen as needed. Provide oral fluid to prevent dehydration, right? Place the client in a supine position with leg elevated, right? Obtain a prescription of corticosteroid. What we want to do is to monitor the client's airway because of the rebound, right? So now the answer is A, guys. So that is it, guys. For everything you need to know about how you assess a client for allergies and intervene as needed. So these are important things you need to know for the NCLEX exam. And trust me, if you get any allergy type question, you would be so strong in getting the answers. So thanks for watching the video.